My name is Jim and I was retired. In this video, we're going to go through signing up for ACA Obamacare in 2023. Stay tuned. I have Medicare, but my spouse is still on the Affordable Care Act marketplace insurance for another few years before she becomes eligible for Medicare. So, as we learned last year, that means one of us is on Medicare and one of us still needs to sign up for ACA. So, I'm going to walk through how to sign up for ACA insurance and how to estimate how much your modified adjusted gross income will be to qualify for the right amount of premium tax subsidies. Stay tuned. One of the first things to do is to start experimenting with how much of a marketplace premium tax credit you might receive based on your expected income for 2023. And one of the places to try to do that is the Kaiser Family Foundation link here to a health insurance marketplace calculator. And I'll show you how I go about using this tool. One is to either select a state or the US average. And for this website, we're going to just use the average right here, but you might select a state. So I'm going to start by entering $55,000 as household income expected, and that's a modified adjusted gross income. And that includes dividends, interest, any small pension you might receive. This is like, let's leave aside IRA withdrawals and start at a base of $55,000. Now, once upon a time, you had to stay below 400% of the poverty level to qualify for premium tax subsidies on the Obamacare ACA marketplaces. But that has now been extended through 2025, where if you apply through this program, you're guaranteed that your premiums will never be more than 8.5% of your gross income. So go ahead and enter your income and see what kind of premium tax subsidies you will receive. The coverage available through you or your spouse's job? No. Number of people in the family. Now this is important. If one of you is on Medicare, but the other is still going through the marketplace, your number of people in family is 2. But the number of adults seeking marketplace coverage is 1. So you need to enter it this way. This is, unfortunately, a little bit of a catch-22. I'm on Medicare, and I find out my entire modified adjusted gross income now only goes towards buying one policy, and you end up not getting as much as if we were buying 2 on the marketplace. Age of the spouse in this case is 61. Tobacco use, no. Number of children, there are no more dependents. This is just one married filing joint couple. And then you submit for the results. And here this says that the estimated financial help is $728, and your cost of a silver plan would be $275. Again, this is a US average. In New Jersey, these numbers don't work out. And so I'm going to show you a more specific way of doing it. If you've got a state that runs its own marketplace, go to that website. If not, then you need to go to the healthcare.gov site. I'm going to show you the healthcare.gov site next, and then I'm going to show you the New Jersey site for the most accurate information in our state here in New Jersey. There's another place to check to see if you can qualify for prices, healthcare.gov, and you would enter your zip code and begin looking at the plans. you can get an estimate before you log in so that you can see what kind of subsidies you might get. And if you are in a state that doesn't run their own marketplace, this is where you will start. Because I'm in New Jersey, I'm going to go in here to show you what the more precise reading of premium tax credits might be in my state. And again, you want to do the most accurate job of estimating how much premium tax you will receive by entering the information into your own marketplace website. Here's a way to preview without signing in and seeing it. You just go to here and estimate your savings. So I'm going to shop and compare. This is where you would enter the information for the most accurate reading of what kind of premium tax subsidies you would receive. In the state of New Jersey, I'm going to say I'm selecting 2023 coverage, and I'm entering a nearby zip code. I've entered myself not seeking coverage, a spouse seeking coverage, and I've not entered my exact birth dates here. No dependents. I'm going to put that initial $55,000 as a base modified adjusted gross income, and I'm going to check for savings. A tax credit of $711 a month from the federal government, plus New Jersey would give you another $100 a month for their program. So I'm going to show what I've done to modify my adjusted gross income for the maximum benefit. I've entered a little spreadsheet here I'm going to go to, and I've started entering these numbers here. This is the premium without any premium tax credits of a Horizon Blue Cross Omni Silver plan. And this breaks down what the monthly premium would be with these tax credits. And then multiplying by 12 gives you this. And I'm going to go through, and I've entered numbers here all the way through 90. For each additional $5,000 in modified adjusted gross income, how much extra in premium would I be required to pay in the year? And it starts off with 700, 780, 852. It jumps here because the state drops, there's a cliff here for the state subsidy of 100 to 50, and that adds up. But then here, it's in the 400s. For each additional 5,000 in modified adjusted gross income, your added cost per year is only about $425, $432. See, there's no state benefit here, just another 172 from the federal government. So this then shows the annual health care premiums based on your estimated modified adjusted gross income. And additional dollars in premiums you would spend based on this. So you can use this plus the taxes you'll pay on anything from the IRA to make a cost-benefit analysis of how much income you want to take to receive the optimal premium tax credits for the year. And I've done a chart here below that's based on this, and you can see where it flattens out in this middle. And this is probably where you want to end up. You don't want to end up here. That's how you can choose how to size your modified adjusted gross income. So modified adjusted gross income is all of your adjusted gross income, adding back in any tax-free interest from municipal bonds. All that gets added back in to judge your modified adjusted gross income. Now, this is all before any standard deductions or itemized deductions. This is your adjusted gross income with the added back in to make it a modified adjusted gross income. So selecting your income is the first step you want to do. Now, you also need to select the right plan. And let me show you how I use the tools to do that. So while I'm in this spreadsheet, let me just jump over to this tab of this spreadsheet. And this is where I put in my Medicare estimates for 2023. All the costs are now known, and I'll be gaining some savings on the Part B premiums because, as announced earlier this year, the 2023 premium will be going from $170 a month down to $164 a month. Likewise, in my shopping for Part D, that value plan that I'm going to be using, the Cigna Saver plan, will reduce my monthly premium down to $13.80 from $36 a month last year. The plan N premiums are going up slightly. They actually had me in as a savings for having a spouse, but because she is not on Medicare at the end of the year, I'll start paying a normal plan N premium in the coming year until she becomes eligible for Medicare, and then we can get a household discount. So that's going up to $120 a month. And so the total of original Medicare plus the prescription plan and the Medigap is going from $317 a month to a little less than $300 a month. And I put a little bar chart here that shows the potential savings, and it includes the prescription drugs, where I was paying a lot of $36 a month for the Part D premium for the drugs. I was only paying $90 for the actual monthly drugs, actually mail order 90-day. That'll be $148 in the coming year, but again, the monthly premiums are much less. So overall, I'm saving about $200 next year. Unfortunately, I'll be spending more on the ACA part of this. Now, I'm going to go back to saying about 85,000 as the optimal in that range there. And it's going to give me this kind of savings, premium tax credits, and then you can say next. And you want to search for the providers that you use. And I'm going to go through just some hypothetical providers in the Cherry Hill, New Jersey area as an example. And it selects the address that you visit and select that address. And I'm going to enter another specialist, just as an example. Let's say an ophthalmologist. Now, this is not an eye doctor because vision care is not covered under the ACA. You have to buy a separate vision care, but ophthalmology is covered under your medical insurance. And so I'm going to select an ophthalmologist. And then you want to go to next. And then here you get to use a level of service that you expect. And let's just say it's medium use. And prescriptions, it's 1 or 2 a month. Let's just say 2. And I'm going to put in that drug, which we know is like a not ideal generic. It's a little bit more expensive generic. And this statin is a more common generic. So enter the doctors you want to visit and your standard drugs that you use to get the most accurate information and view plans. This is important because you want to check and see if the doctors that you use are in the plans. In New Jersey, everything's either an EPO or an HMO. There are no PPOs on the marketplace. And I want to select just the EPOs because they do have the ability to use outside the exclusive provider organization paying higher. It's not as restrictive as an HMO. But I'm going to also select Silver. And Silver gives you the optimal premium tax credits are based on the Silver level of coverage. Now you can apply them to a bronze or gold, but Silver gives you a little added edge. And then you go through here and see here's a plan where the one internal medicine doctor is not in it. Here's one where the ophthalmologist is not in. Here's one where they're all in. Go through and select a couple comparisons where everybody is in. Now, as you go through this, you want to go through and be careful. This is not a marketplace plan, meaning that it's not offering all of the benefits of a marketplace plan, and therefore you may want to avoid these and stick with just the marketplace plans. Also, don't select any HSA plans unless you have a health savings account. You can only use these plans with an HSA, and therefore, if you don't have one, don't select those. And then you can compare to see estimated expenses based on those use cases that you put together, what the cost of insurance, premiums, and care is likely to be in the coming year. And this ranges from $11,000 to $16,000. And again, those are real in New Jersey. You would select to make sure that everybody is in the network. I would also say that don't just rely on this. Go to the plan website and look at their directory and the rules and specifications, because several of them, like Horizon, have tiers. They offer the best benefits for a Tier 1 provider and less benefits for a Tier 2 provider. And you need to be careful with that. They'll say on this site that they're all in network, but they're at different levels. Also look at whether it's co-insurance after the deductible or a co-pay. A co-pay is a little bit money down up front. A co-insurance is you're on the hook for 40% after your deductible. You have to pay all of the deductible and then 40% of everything else. And specialist visits could quickly add up. Check out the ER rates as well. So that allows you to then select a plan that's suited to your needs, your budget, and your expected income. So that's a little bit about how I go about sizing my modified adjusted gross income and the health plan you select based on the providers you see, the prescriptions you use, and the expected use to get the ideal premium for your budget. Hope this was helpful. I'll conclude with my standard warning. I am not an insurance broker. I'm not a financial planner. So take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need one.